The word hypochondriac carries such baggage, and when anxiety goes underground and you keep it to yourself, it grows louder. The stigma doesn't reduce the anxiety. It often adds shame. Everything we do here at Overcoming Health Anxiety is about empowering you, the health anxiety warrior, to speak up, to get support, and to sometimes be your own advocate. The word hypochondriac carries such baggage. It implies that you're overreacting, being dramatic, for a lot of us making the symptoms up, wasting people's time. The nurses, they don't want to hear it. But here's what's important. People with health anxiety, they're not pretending. They're not exaggerating for attention, and they're not imagining their experience. They don't even want the attention. The fear, it feels real. The sensations, it feels even more real. And the uncertainty, it's suffocating you. I know. When the experience gets reduced to a dismissive label, the message people often hear is, your concerns, they're not legitimate. Now, the internal dialogue sounds a lot like, what if I'm overreacting? What if the doctor thinks I'm difficult or just making it up? What if I don't speak up and something actually gets missed? What if they stop taking me seriously? This creates a painful tension. The fear of being dismissed versus the fear of missing something important. And that tension, it leads to more hesitation to ask questions, holding back concerns, or the opposite, over-explaining to make sure you're taken seriously. And this is why at Overcoming Health Anxiety, we love running these support groups, so people can ask the questions and get support and not be told that they're just making it up. The anxiety isn't just about illness anymore. It's about being believed and being heard. Stigma often introduces something powerful in the cycle, shame. And when you have shame, people start thinking, I shouldn't be this worried. Something's wrong with me for thinking this way. I'm being irrational. I'm wasting people's time. Instead of talking openly about it, health anxiety warriors keep the worries to themselves. They search for reassurance privately, which just reinforces an entire online loop of searching. They spend more time Googling or going to ChatGPT or WebMD, and they're mentally reviewing symptoms without sharing them with anybody. And now, the worry becomes more internal and repetitive, which actually increases the intensity. And when anxiety goes underground and you keep it to yourself, it grows louder. Anxiety is like the worst group chat you didn't mute. The more you ignore it, the more notifications you get, louder and louder. Another impact of stigma is credibility anxiety. People begin to worry, what if one day something really goes wrong and nobody believes me? This fear can lead to even more monitoring of symptoms, keeping unbelievably detailed mental records, journals, seeking multiple opinions, and having a heightened vigilance for anything new. And now, the goal becomes proving I'm not overreacting. This concern is legitimate, which people have heard over and over. And ironically, the fear of not being taken seriously, it increases the level of attention and concern you put on your own body. And the more attention the body gets, well, we know about that, the more sensations tend to stand out. And if you don't know about that, go watch the video about ritual self-exams. If you've ever felt dismissed or labeled because of your health worries, I'm sorry. And it doesn't mean your concerns are invalid or that you're being dramatic. It means you're dealing with something many people misunderstand. That you have a nervous system that takes possible threats extra seriously, and a mind that struggles with uncertainty about health. The stigma doesn't reduce the anxiety. It often adds shame, self-doubt, and even more pressure to be perfectly right or wrong about your symptoms, about your medical needs, which actually keeps the cycle going all over again. Because when someone feels they have to prove their worry is justified, guess what happens? Attention and vigilance, it just goes up. The real challenge in health anxiety is difficulty tolerating uncertainty, resolving the doubt, and reducing all that reassurance seeking. And it's not easy. And the stigma, it often increases that uncertainty rather than reducing it. So from this healthcare provider to you, I hope if you're a health anxiety warrior, that you're getting proper support from the people that you love and that love you, and that your doctors do take you seriously, and that you do serve as an advocate for your own healthcare needs. And if you can do that, you are one step closer to learning how to live with fear, not in fear. Much love.